Hi, everyone. Thank you and welcome to the Act Now Tuesday talk. We really appreciate you being here, given everything that's going on in our community and in our country right now. My name is Lauren Stack, and I'm the founding board member and former chair of Act for Alexandria. And it's my privilege to have a conversation today with Dr. Rina Bansal, president of Inova Alexandria Hospital, and Dr. Basim Khan, executive director of Neighborhood Health. As background, the Act Now COVID-19 Response Fund was established in mid-March in a partnership between the City of Alexandria and Act for Alexandria. It was clear from the beginning of this crisis that the nonprofits delivering critical services and programs to Alexandrians were going to need emergency funding to address the rapidly growing needs caused by COVID-19. In just 11 weeks, and thanks to so many generous donors, the fund has raised over $1 million and has already awarded more than $800,000 in grants to 80 local nonprofit organizations. So to get started, I'd like to ask Dr. Bansal and Dr. Khan to share a brief overview of Inova and Neighborhood Health. Dr. Bansal?
Sure. Good afternoon, everyone, and Lauren and ACT, thank you for having me on today. It's a pleasure to be here today speaking with our community members. I know you're probably all well familiar with Inova Alexandria Hospital, but I did want to share a few facts about us that were interesting to me when I first started working here. So Inova Alexandria Hospital is a 302-bed acute tertiary care hospital, and we've been around for almost 148 years now. Founded in 1872, and are the longest running community hospital in Virginia. We have a tremendous history of excellence. One of the first schools in Virginia for nursing, and one of the first emergency rooms in the nation that was 24 hours a day. That tradition continues. Today we are a 5-star rated CMS hospital. We are a Leapfrog A grade hospital for the last 2 years, as well as a top general hospital. We'll get into COVID a little bit, but we are a member of the Inova healthcare system, one of the 5 hospitals that serve our community, and we're proud to be here to serve you each and every day.
Thank you so much, Dr. Bansal. Dr. Khan?
Thank you, Lauren and Dr. Bansal, for being here, and for everyone else for tuning in. As many of you might be familiar with us, but some of you may not, Neighborhood Health is a nonprofit community health center. We've been serving low-income, uninsured, underinsured communities, and anyone who seeks our care in Alexandria, Arlington, and Fairfax County. Started approximately 25 years ago in the Presidential Green Apartments in Arlandria. Since then, have grown to a health center that serves about 30,000 patients every year. We provide primary medical care, dental care, mental health in 13 clinics across Northern Virginia. Most of our patients are low-income, uninsured, and underinsured, and we try to provide them with the same quality of care that anyone in our community would expect. And COVID-19 has, of course, been affecting our patient population significantly, and we'll talk about that in a moment, but it's good to be here with all of you.
Thank you so much. Okay, so let's get started on our conversation. We're interested in how the pandemic is affecting Inova and Neighborhood Health and what you're seeing on the front lines. So let's start with Dr. Bansal, and then Dr. Khan, if you could tell us the same.
Sure. So for us, this really started at the beginning of March, I think March 6th to be exact, when we took care of our first COVID patient in the health system. The tremendous part of being the president of Inova Alexandria Hospital during this crisis has really been the privilege of being part of a bigger health system that is committed to caring for all of Northern Virginia. And I think it really truly spoke to how our system can function in caring for the community. So many of you may not know this, but between Inova Fairfax Hospital and Alexandria Hospital, we were the 2 busiest hospitals in the state of Virginia, ranking #1 and #2 in caring for our COVID patients. And fortunately and unfortunately, we were hit with the COVID crisis up front. So we started peaking in late March to early April, and really had about a 3-week period there where our volumes for critical care patients, people who are critically ill requiring ICU level of care, intubation, ventilators, was much higher than what we've ever taken care of. But because we were part of a bigger system, we were able to leverage resources to care for our community. And at no point in time were we ever close to using all of our resources. So that, was a great learning experience for us. It really showed me and my team what we can do and how we can rise during a crisis and care for the community. Now, it's slowed down significantly. At our peak, we were taking care of about 90 patients a day who had COVID. Now, remember that these patients, can stay in the hospital for a week or so on average. At this point, we're down to about 40, so our volumes have decreased significantly, but we do continue to see it. The other thing I would say from an inpatient hospital care perspective is we've learned a lot about this disease, not just locally, but nationally, and how to care for these patients. And so that has been tremendous learnings for us. And I feel that, from seeing how the patients are doing, we are actually getting better at being able to understand the disease process and manage it in a way that improves our outcomes. So again, not something that I ever anticipated going through when I went to medical school. And incidentally, Dr. Khan and I went to the same place for residency. So we both trained in San Francisco. But, it's what we train for, and it's what we live for, is to serve our community. So it's been a learning experience, but it's truly been a privilege.
Dr. Khan, what are you seeing on the front lines?
When the COVID-19 pandemic started, one thing that we began to notice fairly quickly was the disproportionate impact in certain communities. I remember looking at a map from New York that was showing the positivity rate by zip code in the different boroughs. And in Brooklyn and Queens, where you have higher percentages of low income and immigrant populations, you were seeing much higher percent positive rate than you were seeing in some more affluent areas in Manhattan. In the absence of really widespread testing, one way you can look to see if a certain community is more impacted is by looking at the percentage of tests coming back positive. And so early on, and then we saw this nationally as well, we saw deaths, for example, among African Americans were much higher, disproportionate to the population in a certain area. So early on, we had this sense that this would impact our patient population significantly. And when we started testing, we began seeing it right away. So 50% of our patients, or actually closer to 60 initially, were testing positive for COVID-19, those who we were testing, symptomatic patients. And if you compared that at the time to the rest of Northern Virginia, it was more than twice the amount. The rest of Northern Virginia was sort of it peaked at about 25% testing positive. In DC, it was 20 to 25%. And then across the Commonwealth of Virginia, it's been much lower. So, we've been noticing that our patients have been disproportionately impacted, are testing positive in much larger numbers. And the reasons I think are familiar to most people by now. This pandemic has really unmasked underlying issues around so many issues that we talk about, and it's really shown a light on it. Our patients, we've actually we've asked them sort of, what do you do for a living, and just trying to learn more about the people who've been impacted. And most of them, they work as cleaners, housekeepers, and construction. A lot of grocery workers, a lot of your frontline essential jobs. Many of them take public transport. Many of them live in very crowded conditions. We've had patients who, telling anyone to isolate from family members is difficult to do it properly. How about sharing a room with 4 or 5 people, some of them who are not your family members, but you've actually rented out. I spoke to a patient last week who, the reason she fell ill was because someone she had rented her room to fell ill in his job and then passed it on to the rest of the family. So a real significant impact among our patient population, which is already facing so many challenges, let alone the economic issues that they're facing. So that's really reverberated across our organization. Our patients are testing positive in really large numbers, perhaps a little less now than before. And we've had to make all sorts of adjustments in relation to that, increasing testing, supporting them, and a lot of other things that we can talk about later. but the impact has been significant among the patient population that we serve. Another point that I want to make is, we've done about 2,000 or so tests, and about half of them have come back positive. Our entire patient population is about 50 to 60% Hispanic, but among our COVID-19 patients, it's about 90%. So again, really showing the disproportionate impact on certain segments.
Dr. Bansal, you talked a little bit about how COVID can range from, the range of the disease from undetectable, staying at home, to fatal. Could you talk about a little bit more about that, and then how that's affected the operations actually at the hospital?
Sure. So we know, one, that this is a very contagious disease, more so than what we've seen in other viruses. So it does pass on from one person to another quickly. Now, how someone reacts to the disease process is very different. And so you can have people who are asymptomatic, right, who are carrying the virus but have no symptoms at all, to some people who have, an illness that's somewhat mild, to others who end up being in the hospital, either on an inpatient ward requiring some support, but not in an ICU level of care. And then some patients, usually with other comorbid illnesses or disease processes or something that compromises their ability to deal with an infection, can end up in the ICU. So you do see this whole range. And I think what is challenging really is, from running an operations perspective, is how do you, one, protect your patients and take care of them well. Two, how do you keep your team members safe who are actually caring for those patients? And three, how do you minimize exposure from the community? And so, from a clinical perspective, like I said, our teams have done a tremendous job taking care of patients in the critical care setting. Our physicians, our APPs, our nurses who've trained in real time, to increase our capacity to take care of the really sick patients. But from a team member perspective, we had to do a lot of education around personal protective equipment. One, making sure that they had that, and that was never really an issue for us as a health system, which we were blessed for. Two, how to use it properly, and to keep up with the changing guidelines. In regards to the visitors, that was tough, because, when people, sick ones, loved ones are coming in sick, and not being able to see them is very challenging. But we had to do a visitor restriction, because we can't have people coming in who may be asymptomatic and are carriers of the disease. So that took a lot of education on part of the community, but I would say the community was very receptive and understanding of it. It was challenging for the perspective of communication between patients and their family members. Some people have their personal devices that they can use, FaceTime, phones, but we did spend a lot of resources on making sure that we had access to technology such as iPads that allowed our patients to then communicate with their family members. And obviously we made, some leniencies in the restriction policy depending on how ill someone was and if this was an end-of-life issue, which was really also very emotionally challenging, obviously for the patients and their families, but also for our team members. Mm-hmm. But, from the range of the disease, it is tough, because, you can be walking around being a carrier and not know it, or you could end up in the ICU really sick. So it is a whole spectrum.
So Dr. Khan, I can imagine this presented a lot of challenges for you and your organization, because your facilities are smaller and your population, it's probably harder to socially isolate. Can you talk about what you do in the facility?
Yeah, absolutely. We, I think any healthcare institution, or frankly, any place of work, your first priority should be the safety of your employees, people who are actually doing the work. And when this started, that we already had an influenza preparedness plan in place, pandemic preparedness plan, but clearly this was greater than anything we had anticipated before. So initially, a lot of the steps we took were to do whatever we could to ensure that our staff is safe. It was particularly important because a lot of our staff come from the same communities that are being impacted. So many staff members are actually getting sick at home. And so it's even more important that we do whatever we can to make sure that everyone is protected. It took several forms. First of all, you had to make the transition to telemedicine that everyone has done now. So it's remarkable looking back how quickly some of that had to happen. These are things that people sort of take months to try to figure out, or even years. Healthcare is notoriously slow sometimes, but this was one situation where we couldn't be slow, and within a matter of days, we transitioned everything from in-person to virtually telemedicine. There are still some in-person visits, well child, care for children under the age of 2 to get their vaccines, some prenatal care. Some things clearly need to be done in person, but transitioning everything to telemedicine, especially for us where we didn't necessarily have the infrastructure in place, was a big task. And, I really credit our team for being able to do it really quickly and do it in the way that they did. The other thing is trying to ensure that there's safety in the workplace. PPE is a big piece of it, personal protective equipment. Of course, the minute all this broke out, it became a challenge to actually order anything. Anytime we tried to order something, it was on back order. Nevertheless, we did have a certain supply because of our preparations, and we have been able to keep on top of it until now, which has been great. There's been a lot of support from the community. This was one area where the fund was really useful because it allowed us to purchase some PPE, some additional personal protective equipment. The other thing is barriers. So we put up glass barriers. All the clinics, probably within a weekend or two from this starting. So again, within days. Again, this is where the fund was also useful in allowing us to purchase some of the, and able to allow us to put that into place. Temperature checks, really beefing up our employee health operation, a lot of testing. So we've had to really do a lot, as have other healthcare organizations, to ensure that our staff are safe. And we continue to evolve, we continue to change. Just because a guideline was a certain way a few weeks ago doesn't mean it's the same now. Things change all the time. Return to work, how we get people to return to work. There's so many things that are changing by the day. I think the important point, though, is this isn't necessary just in healthcare. As our economies begin to open up, I think it's incumbent on any organization, any place of work, to do whatever they can to keep their employees safe. It's incumbent on public transport to ensure that everyone riding public transport is safe. So it's a continued responsibility that we all need to have, and will continue to need to have, because if our employees are not safe, then you're not really able to do anything.
We've got just one comment in chat that I wanted to read. It is with regard to partnerships with to you, Dr. Khan. It says, Casa Chirlagua is grateful for our partnerships with Neighborhood Health. What an honor to work with such an incredible organization. Dr. Khan and his team are doing incredible work to bring vital COVID-19 tests to our community. Thank you. So thank you for that. And audience, if you have questions or comments, be sure to put them into chat and we'll try to get to everything. The one thing that you brought up, Dr. Khan, and I think both of you could answer this, is with regard to things like telemedicine. So do you see that being something that, now that you have the skill set to do that, is something you'll be using moving forward after COVID? And either one of you can take it.
Sure, I can start. So on the inpatient setting, again, we are limited. Where we use telemedicine significantly is really for patients to communicate with their family members, and also for some consultations. So you can minimize the number of times you have to go into the patient's room, and therefore, really protecting yourself as a team member or as a physician who needs to be taking care of that patient. We have seen it a lot in our offices now. So Inova Medical Group, which is our outpatient practices, really has done a tremendous job. Telehealth was something that we as a health system were looking at, and although it's prevalent in the community and nationally, I think for healthcare systems, the norm was that you would have people come to your office, and then you would be seen by your physician, and then you would get your care plan. But we're realizing that people are actually much more technology savvy than they ever were, and now they need to be. So we have a lot of physicians' offices who are transitioning to telemedicine. I think it will really depend on the reimbursement models. I think that's been a challenge for telemedicine for a long time in terms of adoption and implementation, and how that impacts reimbursement for the providers. Also, the safety, the compliance, and just that human interaction. But I definitely do think that this will have long-standing impact. on how healthcare is provided for the better. I think it will increase access, while maintaining that patient-physician relationship.
Mm-hmm.
I completely agree with that. It's always the case, perhaps, where in a crisis, it makes you see clearly and in determining what's important. And I think in healthcare, there tend to be a lot of barriers that are unnecessary. And the requirement that every single visit be done in person when a lot of things can be done over the phone or through video, I think that was something that restricted access to care. Of course, there are situations where things do need to be done in person. There's no substitute for an in-person physical exam, and I'm primarily talking about the outpatient setting and, of course, procedures. But there's so much that can be done virtually, and I think and it saves patients time. It saves them the inconvenience of taking or they don't have to take time off work. So I think it's great. I think that could hopefully is one positive thing that'll come out of this. Again, it's not going to be exclusively telemedicine. It'll be a mix, but hopefully that'll continue into the future. But there are a lot of policy and reimbursement issues that will determine whether that actually happens or not.
Mm-hmm. So we all know that Alexandria is opening back up. And what does this mean for Inova Neighborhood Health? And do you have any tips on how people watching this should care for themselves and others? Whoever wants to take that
I'll
first.
let Dr. Bansal first.
Sure. So again, yes, Alexandria is opening back up, and I think all I can say is that healthcare provider, I do worry in that how good are we going to continue to be to maintain social distancing, to practice hand hygiene, to keep our masks on. Trust me, even being a physician, I hate having that mask on, right? It's tough. It's not easy. It's not our norm. But unfortunately, it is the new normal for now. So what I would ask our community really is to continue to be mindful that the virus, COVID still exists in our communities, and even though it may be decreasing, it doesn't take a lot for it to increase again. So to continue to protect yourself, protect others, be mindful of social distancing, and continuing to do the proper hand hygiene and masks while you're outside. But again, I'm not sure how much longer someone can lock down the economy either. So I think it's a fine balance, and we'll have to see what happens.
I completely agree. I think this is really tough because getting people at home, allowing people or saying that people can't work, it's really difficult. And while the lockdown was necessary, or wasn't really a full-fledged lockdown, but while having people stay at home and what we did was necessary, clearly at some point things will need to open back up because people need their livelihoods and whatnot. So I think while that happens, I am also concerned. Frankly, I think while things have gotten a little bit better, we're still nowhere near out of the woods right now. Things are somewhat better, but we're nowhere close to normal. There's still a lot of people getting infected. There's still a lot of people being hospitalized. There's still a lot of people dying. The possibility of increased spread is still there, and I just wish that perhaps at the national level we had been more aggressive about this, and we had really set our targets on really controlling this in a way that hasn't yet been controlled. So I think when people talk about reopening, there's the assumption that we've taken care of this, or when people talk about a second wave, there's the assumption that the first wave is finished. But the reality is it's still here, it's still going strong. There's still a lot of infections. People are still getting impacted. But at the same time, I do understand that we do need to reopen to some degree. And so I guess what I would say is that we need to really ensure that we're doing whatever we can to keep ourselves safe, keep our families safe, and keep those who don't have people advocating for them or in more difficult situations, or who don't have the economic means to perhaps be as safe as others, do whatever we can to protect them. That's why I'm really happy about the mask mandate or that was recently announced in indoor settings in the workplace. I think it's absolutely necessary to respect and to protect frontline workers in all types of settings. I think the same for public transport. So I just feel like we need to do whatever we can to not let our guard down and ensure that those close to us are protected, but also those who are less fortunate and aren't able to protect themselves in the same way.
I've got a question in chat for you, Dr. Bansal. Are there any available antibody tests that are reliable here in town? You're on pause.
Yes. So we have started doing some antibody testing. We're actually doing it as part of a research study at Inova, and we've done some testing for our team members. There is a false positive rate with the antibody test, and I think the other thing that we need to understand is just because you have antibodies doesn't necessarily mean you're immune to the disease. So it can give you a false sense of hope or sense of security that now you can be out there and be exposed to COVID and be perfectly fine. And so I would say at this point, there's nothing that's completely reliable. A lot of the testing that's available has a false positive and a false negative rate, meaning that it can be positive when it's not, and it can be negative when it's not. So I would say, you really need to do it in conjunction with your healthcare provider, understanding, what are your symptoms, what is going on, and then do the appropriate testing to see what is going on with you specifically.
Okay. Dr. Khan, I have a question in chat for you. So there's been a lot of attention in the press to the issue of skipped or delayed medical care as a result of the virus. So what's been your experience at Neighborhood Health, and what's the impact of avoiding or delaying health services? What are your biggest lessons learned during this?
I definitely think it is an issue. We've anecdotally seen people avoid services. I'm sure it's the case with the hospital, perhaps even more so. The other thing is when we look at some of the data around excess mortality, it's tough to tease out how much of it is COVID and how much, obviously a certain amount is COVID, but there are increases in mortality and morbidity around other illnesses as well. So that's definitely an issue. And I think over time, you'll really get a sense of how much of an issue it was. And it's all about striking the right balance between being safe, not doing things that are not necessary, but at the same time, when things are necessary, healthcare facilities, whether it's a hospital or community health centers like ours, are doing whatever possible to ensure that both patients and staff are safe. I think another piece that's really important here, and this goes to the heart of sort of what we do, is the importance of primary care, and the importance of relationships between individuals and the healthcare provider. Because when you have a relationship already with someone, with a doctor or nurse practitioner who you can trust in, you can be in touch with, they're able to guide you through these difficult decisions or these difficult processes around, well, should I come in for this, or can this wait or this not wait? We've definitely put certain things off. I think all healthcare providers and institutions have put certain things off that they felt everything was a risk, a risk advantage benefit, right? So is it worth putting it off? Is it not? So if you have a good relationship with a healthcare provider, a primary care physician, or someone else, it helps you make those, navigate these difficult decisions. But generally, yes, it is a problem. No doubt about it.
Lauren, can I add to that?
Because I was going to say, yes.
This is a very important community health issue. So, up front, I'll be honest, I think we were so overwhelmed with what was going to happen that, we were anticipating a huge surge of patients, and we did get that. But I think the consequences that we've seen of the COVID-19 crisis is really a fear in our community of accessing healthcare, probably both in a primary care setting, but also in a hospital setting. I think people are afraid to come to the hospital because they have this vision, of people here who have COVID and that they're going to get ill. I would argue that probably hospitals are sometimes the safest places to be because it's a controlled environment versus going to a Walmart or a Target, but that's just me. But I do think it's important. We've seen a significant decline in number of patients coming in for heart attacks. We've seen a significant decline in number of patients coming in for strokes. And these are not disease processes that have magically just vanished because we have COVID. I think it's because people are actually suffering at home. We have had a decrease in our emergency volumes of over 50%. So on a normal day, we would see about 200 patients in our emergency rooms. we're seeing, somewhere down to 90 to 100. And again, I talk to my peer physicians, and, it's funny because they'll say, it's almost like all other diseases just disappeared, right? And it's like, well, the diseases didn't disappear, but I think the fear is keeping people from seeking help. So I do really want to emphasize this, because we don't want our community members to be suffering at home. All our healthcare facilities are open and ready to serve our population. And we are making sure that we keep anyone who's coming into our hospital safe, with or without COVID. So please know that. And this is a national trend. This is not a local trend. I've read articles where there's been a 40% decrease in number of people showing up with a heart attack, right? I mean, we haven't all of a sudden cured heart disease. People are just not coming. So that is a very, very important point, is continue to seek care for regular medical issues, even if you don't have COVID. So that is important.
And so that leads directly into another question that we have, and I think this is important for both of you. The pandemic has clearly impacted, for example, neighborhood health, and I know Inova. How are your organizations faring financially, and what can people on this call do to help you weather that storm? Dr. Khan, you want to take that first?
Yeah, so, like any healthcare organization, and frankly, any, business or nonprofit, we had a significant decrease in our revenue because of this. A lot of our insurance revenue, or what we call patient revenue, decreased dramatically as some of the volumes decreased initially, and because of the shift to telemedicine. So there has been a significant financial impact. Fortunately, there has been support from various quarters, but it's a challenging situation that we're in right now. At this point in time, we have had enough support to be able to continue our operations at existing levels, and in fact to ramp up in certain areas because there's demand in the community. So like that includes testing and accommodating new patients. But over the coming months or year, there are challenges ahead unless something changes. So like any other organization, both as a business or as a healthcare provider, but especially one that is sort of on the front lines in terms of the community being impacted, it has had an impact on us. We have had support, but of course, any additional support is always welcome.
Okay. Dr. Bansal.
Sure, thank you, Lauren. So again, we are a nonprofit health system, and so we've always been very cognizant of our resources and how we utilize them. But the pandemic really has been a significant challenge. On one hand, you have an increased use of resources from a critical care perspective, which is the most high-end resource in a hospital setting. But at the same time, you have a significant decrease in your patients. You're not doing any elective procedures, so we've had a significant decline of almost 40% in our revenue. Some of the numbers are just astounding. It's even hard to process how much money you can lose on a daily basis in a hospital setting while providing care during a crisis. It almost doesn't make sense, but that is the reality. We did open up our operating rooms a couple of weeks ago, so we are starting to see some patients come back. But as I spoke before, that fear of coming back to the hospital is persistent. So I think it is keeping people from seeking elective care and, getting surgeries done. So it's had a tremendous impact. What we really have done on our side is really cut down any discretionary spending. We've had some layoffs, and I'm sure people have heard that in the news, but really, it was around the infrastructure, not anything that was clinical, nothing that was at the bedside. But for example, assistants, right? As an executive, you have an executive assistant, and, we did have to, cut some of those positions. So I think just being more fiscally responsible, looking at all of our spending very diligently, and making sure that we're only spending what is absolutely necessary to continue to care for our community. But it is a tough time. We are appreciative of the generous support of our community, and we're always open for more.
Yeah. Could you, as we're starting, I've got a couple more questions. Could you tell me the top 2 lessons learned you've taken away from this? Dr. Bansal, you want to start with that?
Sure. I think resiliency and agility and flexibility is key. Really, I mean, we talk about resiliency as at baseline, but what this has taught me is, how important it is for you as a team to really rise above the circumstance and to really manage a team of 1,600, employees and team members to serve our community. And how much resilience it requires on the personal level, on the professional level, at an organizational level. The other thing I would say is flexibility and agility. Dr. Khan alluded to, earlier, guidelines are changing, on a daily basis. What you're doing one day isn't the right thing to do the next day. What medication you're using one day isn't the right medication to use the next day. And that's just a small example. But being flexible and agile so that you can turn a whole organization based on what the changing, guidelines are. But I will say this, again, I know Inova Alexandria has been a community hospital for a long time, but we are part of a health system, and the value of being the part of a health system has never been more evident to me than now, because we really have had a team of experts that have sat at the system and looked at this on an hour-by-hour basis, ensuring that we have the right information, the right resources, that we're getting the drugs that are necessary, the plasma, that may be needed to treat patients. And so really being able to manage all that in an effective manner to then provide for our community. But resilience and agility are my key learnings from this pandemic.
Okay, Dr. Khan.
I think having a pulse on your staff's morale and really prioritizing that is critical. And that doesn't mean glossing over things. It means really understanding some of the fear and some of the apprehensions and just the difficult situation that staff members are in, both because of what they're seeing and experiencing at work, but also generally what's going on at home and more broadly speaking. And that's actually even more the case given sort of the issues that I've raised that have been brought up again, and really kind of trying to understand that, address that, and do whatever you can to work on staff morale is important. The second lesson that I continue to learn, and it continues to just amaze me, and that's been the case this time around, is really how everyone wants a sense of purpose and wants to connect to your mission. And again, I feel in the work that we've done and, being around our colleagues and our partners, I just continue to get uplifted by that. And that's definitely been the case in this pandemic where, staff members from all walks of the organization have really stepped up in ways that are inspiring to, me and to others. And, to encourage that, to celebrate that is really important. And it's been great to see that.
Well, Alexandria is lucky to have both of you as leaders, and I know this has been a big challenge. Could you tell me one way that this has had a personal impact on you as a person? Dr. Khan, you want to start with that?
Fortunately, I guess what I'll start off with is that I'm obviously grateful. There's a lot to be grateful about in this situation. Obviously, it's been really difficult economically, and of course, the health repercussions have been great. And I'm fortunate that that hasn't. I've been in a relatively positive situation. I was planning to get married relatively soon, so you can imagine trying to figure out how that would work, especially with a South Asian wedding, which involves a lot of people. So we're kind of scratching our heads to try to figure out how that will work. Maybe do it on Zoom as well, but I'm thinking about that. Well, who knows? We'll see. But that's been one impact that has happened personally.
Mm-hmm. Dr. Bansal.
Sure. So I would reiterate what Dr. Khan said. We are blessed, to be gainfully employed, to be able to serve our community, to be in circumstances that a lot of people are not fortunate enough. So I am thankful for that. And I remind my 10-year-old and 13-year-old that every day when they're complaining about not being able to see their friends. For me, my family does live in India, and recently my dad started to have chest pain, and it really brought home to me how I will be able to go back if I need to go back emergently. Things that you've taken for granted for a long time, moving away thousands of miles because you think you can get on a plane, is not the reality anymore. But he's fine, and I'm fine. I don't need to fly anywhere. But and it really highlights the importance of family. And I think, you'll probably hear a lot of people say that. I talk to my family in India significantly, but now we're doing, weekly Zoom calls or, Google Duo calls or whatever the technology may be. And so it's forced us to come closer together, even when we haven't really been in physical proximity to each other. So that's a blessing. I think it's really taught everyone what's important and what is not as important, So I think that's the personal impact it's had on me.
So as we're wrapping up, can you give us some marching orders? How can people listening to this call help you moving forward? It's clear the needs are great, and could you give us some specifics? So Dr. Bansal, do you want to start with that?
Sure. So we do have a COVID-19 website, and we can send a link out later, and that definitely has many ways that you can help us as a health system. But as a physician, I would say keep yourself safe, take care of yourselves, your family members, reach out to each other. A lot of people are suffering emotionally and mentally. This has been a very challenging time. And also, not to get into the politics, but the more recent events are just also highlighting a lot of an emotional crisis and everything that we're going through. So just being supportive of each other and reaching out to each other.
Thank you. Dr.
Likewise, we also are accepting financial support for our COVID-19 response, and of course that would be helpful. And the same thing, I think we should remember that this isn't over. It's still out there in significant numbers, and we should do whatever we can to keep ourselves and each other safe. Especially those who are less fortunate, to try to ensure that they're protected. And I'd also like to say the importance of compassion and empathy and lifting each other up during these challenging times. I think one underestimates how important that can be and how much of a positive impact that can have in general, but I think that's especially the case in times like these. So even a word of encouragement or checking in on someone, those little gestures can go a long way in times like these.
Thank you both so much for taking the time from your very busy days to talk with us. And thank you for everyone that's listening. I really appreciate it. Before you sign off though, we have two important announcements. Tonight from 7 to 8:30, there's a virtual town hall to honor George Floyd and to provide an opportunity to share your voice. So this will be the first in a series of town hall discussions to promote sharing and understanding how systemic racism is impacting in Alexandria. This program is an emergent collaboration of community members, the city government, and nonprofit organizations. So this will also be on Act for Alexandria's Facebook Live. Please visit ACT's Facebook page for Zoom registration details. And I hope that you found this Tuesday talk valuable. We have another one in a couple of weeks. And again, as we well know, the pandemic is disproportionately affecting communities of color. ACT President and CEO Heather Peeler will facilitate a discussion on racial equity with Jacqueline Tucker, Race and Social Equity Officer for the City of Alexandria, and Evelyn Utria, and I'm sorry, I'm sure I'm pronouncing that wrong, the Executive Director of Tenant and Workers United at noon on June 16th. So please join us. Until then, please be well and be safe, and thank you.
Thank you.
Thank you.